When you need medical help fast, use NHS 111 online to go from home to an urgent treatment centre
Mr. Williams, please come through.
or a pharmacy.
Hello, pharmacist will see you now.
Or if needed, stay where you are and get a call from a nurse, doctor or paramedic. Get assessed and directed to the right place for you in as little as 90 seconds. Use NHS 111 online.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi and welcome to Our People podcast. My name's Harry Newhouse, and on today's episode we will be shining a light on the fantastic work of cancer clinical nurse specialists to help celebrate National Cancer CNS Day. With me to do this is Kelly Craggs, Alison Bruce and Michaela Fleury. Welcome to the podcast, Kelly, Alison and Michaela. Kelly, would you like to tell us what your job is here at the Trust and explain a little bit about what it involves on a day-to-day basis?
Hi Harry, thank you for inviting us along today to speak to you. So my role within the Trust is the cancer lead nurse. The kind of main nuts and bolts of my job is to maximise the nursing contribution to cancer services. So this involves supporting and developing the nurses that care for our cancer patients, leading our cancer specialist nurses and managing the support services to ensure our patients receive care that is personalised to them following a cancer diagnosis.
Same question to you, Michaela.
So my main role is a community staff nurse. So I'm based at Grindon Primary Care Centre and I work across the west of Sunderland. In my day-to-day job, I usually support people that might have long-term conditions, chronic and acute wounds, and a lot of palliative care following discharge from hospital. Generally patients that are housebound and want to be cared for in their own home.
And Alison?
I work for the out of hours team, the palliative care team, which is based at St Benedict's. So when the district nursing services end, our team takes over to support people at home. With the main aim is to symptom manage. That can be crisis visits, it can be planned visits, people that are on care of the dying, they require a third visit as a gold standard. So our team would be expected to do that visit. We give advice, support, and meet the needs of the patient, whether they're to stay at home or whether they need admission, anything like that. We would sort that for them.
On the 26th of April, it's National Cancer Clinical Nurse Specialist Day. Kelly, could you explain a bit about what that is and why we have such a day?
So it's probably helpful to kind of explain the role of the clinical nurse specialist firstly. So the clinical nurse specialist is kind of just that. So within cancer, it's a nurse with a specialist set of skills that works generally in either a certain area of cancer or within a specific disease. So our clinical nurse specialists, have expertise that is really essential to the functioning of our cancer multidisciplinary teams. And they have lots of skills in terms of once a patient has a diagnosis with cancer or is referred with a suspected cancer, they really become the key person who coordinates a lot of their care. They're also very specialist in terms of supporting patients with that diagnosis. That's physically, with the management of the disease. That's also around their symptoms. That might be symptoms related to disease or related to treatment. Lots of kind of psychological support. And to try and meet their needs that are personal to them. So that's looking at their wider support needs as well. So it's a really important role. It's a role that's been around for decades, but it is very much evolved over recent years. We have advances in diagnosis of cancer now, advances in treatment and in management of the disease, which is becoming increasingly complex. This creates a lot of new challenges for our clinical nurse specialist workforce. The aim of the National Cancer Clinical Nurse Specialist Day is to raise the profile of our cancer nurses at a time when patients in the cancer workforce need them more than ever.
Last year, the Cancer Internship Programme was set up. Could you tell us a little bit about what the programme is?
Yeah, sure. So the Cancer Internship Programme was designed to provide our general nurses who have an interest in cancer to develop their knowledge and skills and expertise. they may wish to pursue a career in cancer, but also develop their current practice and share their knowledge with colleagues to improve care for patients within their clinical areas. So the programme offers the opportunity to work with our cancer specialist teams across the Trust, and with our cancer support services, and also with our tertiary centres, to develop an understanding of the needs of patients across the entire cancer pathway. It also has an academic element, and this enables nurses through their learning to review practice in their clinical areas and really look at ways in which this can be improved for cancer patients.
Why was there a need for the programme?
So, having described the very important role of the clinical nurse specialist, historically recruitment hasn't kept pace with the increase in demand for cancer services. We recognised here at the Trust that we have an aging CNS workforce, and there was a need to develop a pipeline of cancer nurses with the knowledge and skills so that we can continue to provide excellence in cancer nursing services.
And Alison and Michaela, you two are interns on the programme. Could you tell me what it is like from your perspective and tell us what you have to do on the programme?
We're allocated a hub, which is our main domain. So mine's urology, and then from there you get spokes. So you visit all the different areas, the specialised areas, so you get exposed to as many different fields, as many different areas as possible. And that's ongoing for the year. There is the academic side, which is based at Teesside University, which is an academic module that involves workbooks. There's 10 workbooks, and there's feedback from your mentor to suggest developmental areas of knowledge gaps and skill sets, and from there you're identifying a plan to move forward and develop. The idea is to visit as many sites. I've been to the RVI, I've been to the Freeman, and the idea is that it's a two-way process, that not only do we learn from our mentors in placement, but they learn from us because we can bring a lot of experience as well. So it's been really a really good experience.
And I think alongside what Alison's mentioned about the uni work as well, we get to develop a service improvement, which the Trust have been very supportive of. And at the moment, our ideas, I think a lot of them you might end up seeing in the future. So mine is to develop better referral system for cancer services. I think Alison's is looking at mouth care as well. I think overall, to sum up what the internship is like to me, is it's kind of allowing us to be supernumerary in a way and learning, which you don't at the minute because of how busy the NHS is. You don't actually get the option to do. So it's letting us learn, and as well as working at the same time and taking things back into our own area of practice to improve patient outcomes.
Why did you decide to apply for the internship?
I work for the Palliative out of hours care team, and my role is be more towards the end of life or acute symptom support, and I found it quite difficult to appreciate what the patient's been through, because I don't have experience from diagnosis to end of life. There was a gap in my knowledge, and I think to see things from a patient and family's perspective, you need to know what that person's been on, the journey that they've been on. So for me, it was to bridge that knowledge gap, and so that developing my current role, because at the moment there is opportunities, but I think for a more grounded knowledge, this is one of the reasons why I applied for the internship.
I think my reasoning is exactly the same as Alison's. I'm quite a junior nurse in my role, so I have big knowledge gaps when it comes to the cancer journey and what the patient goes through. And primarily in my role, we focus on the kind of more end of life and palliative stages. And often in your normal working day, you come across terminology and things that you don't understand. So how are you meant to kind of educate your patient on them when you don't know? It's to kind of advance my career. I'm a bit ambitious, and I loved the idea of doing this internship to gain more knowledge, and it looks good on the CV as well, and it opens up opportunities in the future because I really want to get involved and be a cancer nurse specialist.
How beneficial are you finding it? How much have you learned on the programme?
Oh, it's invaluable. You know, you don't appreciate the role of the CNS until you're actually working alongside them. You think it's, I suppose you think, the nurse is just going to support the patient, but that's only a tiny, tiny little bit of what they do. Invaluable as it is, it's all the scans, it's following patients up, seeing them acutely, seeing them in clinics. There's just so much that they do that you just don't realise until you're actually working alongside them.
And just to add to what Alison says, it kind of gives you a newfound appreciation and respect for the role. And like you sometimes I go into different like sport placements and I think, why is there not a CNS here already? And I think the benefit of this programme is that there's going to be people like myself and Alison that can hopefully go into them roles and improve the service and improve patient outcomes. But to go back about how much like I've learned personally, I've learned how to better manage symptoms for patients. There's often treatments patients receive that I didn't know what they were, but going back into my community role, I know that, that patient's getting that symptom because they're on this treatment, and I'm able to explain that to the patient and manage it more effectively.
Have you got any plans for when you finish the programme?
I would like, because I've been exposed to a lot of different areas, I want to get to the end and then know that if I did apply for a CNS post, that's because that's where I want to be and not because there's a post available. And I've had the luxury of being able to be exposed to the different areas and think, not fussed on that area, but if there was a post come up there, I would love to go for it. And I think sometimes, like when you read a job description or you think in your head you kind of know what somebody does, and then when you get there and you think, no, I don't know what you do, but then you think, there's a job there, I would love to go for that, and I'm going to go for it because I've got the knowledge behind it and the experience, be it limited, but you've still got an insight into the role.
And I think that's the absolute beauty of the internship, is that you can go to so many places, like different tumour site areas, and you're able to see how different people kind of work, and like it lets you kind of be a bit more picky, and lets you kind of decide like, this is where I want to go into in the future. And you wouldn't really have that kind of luxury in your own role because it's so busy, and you kind of only have that involvement when you've got a patient with that specific type of cancer. But I think that's allowed me to kind of think of what I want to do in the future, and hopefully I do want to specialise in a cancer site, but at the moment I'm not quite sure, but we're only halfway through, and I've enjoyed everywhere, so it's not a case of I don't like the different places, I like them all.
And I think just listening to the specialist nurses already in post, I think they're quite envious of us because they've never had the opportunity, and there's many who'll comment and say, I wish I'd been able to do something like that, or even in their role, they'll say, I wish we could go and do something like this. You get and they're working in that area, so we're quite privileged. In fact, we're very privileged to be able to do this.
And starting the role, but you feel so much like prepared than all other people maybe in the past.
I don't know about Alison, but I'm just astonished at the level of expertise and knowledge that some of the specialist nurses have, and it kind of knocks me confidence a bit, because at the minute I think, I don't know if I'm ever going to be that knowledgeable in that role, but I think doing the internship is a great basis to start on.
Will the programme be happening again next year?
Yes, so I'm very pleased to say that it will be running again next year. So we're looking to be recruiting over the next probably month or so, with a view to probably starting another 5 interns around September time when the ladies finish their internship. So that's really, really good news. So I hope people watch out for that, and we'll obviously circulate that through the comms team and things, that expressions of interest for the course.
And is the application only open to staff working here at the Trust?
So it is open to staff just at the Trust, so it'll be advertised internally. But we, you know, obviously Alison and Michaela are both community nurses, so, you know, obviously we offer it to our community teams as well.
Last year you received 30 applications for the programme, however there were only 5 places. Kelly, what advice would you give our staff who are wanting to join the internship and applying?
Yeah, unfortunately places are limited, and you know, obviously we've got to make sure that all of our learners get the best experience with each of the clinical teams, so we couldn't have too many, you know, people learning in one place. There was a lot of interest last time. I expect, you know, listening to, you know, the wonderful comments from Alison and Michaela, that there'll be even more interest this time round. So I would just urge nurses to apply who are really passionate around cancer nursing and they want to make a difference. You know, like these 2 ladies do. But they also need to be committed to the learning on the programme so that they get the best out of it, because, you know, as the girls have said, it is a fantastic opportunity. And it is quite a commitment, the learning, isn't it? So I think you need to be prepared to, you know, a lot of it it consolidates what you're learning in clinical practice, but it, you know, it does take some of your time up, doesn't it?
Yeah, I think you've got to, because of the uni module alongside, it is really interesting, but you've got to be quite dedicated to doing the work and be quite organised, because doing the role alongside a full-time like job in the community as well can be quite demanding at times, but in the long term it's going to be so beneficial, and it's been really rewarding so far.
Alison and Michaela, would you urge our staff to apply for the programme? And obviously it sounds like you've enjoyed it so far.
Oh, hey, yeah, anybody with an interest in palliative care, definitely. You'll never get an opportunity like this again. So if it's something that you're interested in, just go for it, yeah. I've really enjoyed it. And, you know, it's not just the CNS, you get an insight into their roles and, you know, the MDT, how the MDT is put together, from the 2-week rule, that, you know, from the admin side, you have a full appreciation of the cancer services as well, which, you know, you wouldn't have the opportunity. So you think, oh, you do a referral, it's all the difficulties that come if that referral's not done properly. So it makes you think more about what you're doing in your own practice. And like you say, you know, you're taking things and, you know, awareness of, you know, as treatments, and they use a lot of immunotherapy now, so it's side effects that, you know, you think the side effects can appear after 2 years, which is something I never thought about. So I'm treating symptoms, but actually is it a side effect of an immunotherapy, which I wouldn't have thought of before. So it, you know, it's just been so invaluable that, yeah, definitely go for it.
I've already been recommending colleagues to apply for it. When it first came out, was advertised last year, there was a few people I worked with that were kind of a bit tentative about applying, and it was the same myself. I was unsure whether I'd never mind like get through the application stage, but I'd urge anyone that's interested to apply. It's you'll learn loads. You, as Alison say, you have like a newfound respect for the clinical the cancer nurse specialist role. And if you are interested in cancer, I mean, I was interested in cancer, but I was quite naive to as what went on. I mean, I'll openly admit, I thought there was only one type of chemotherapy that everybody got, and like everybody was sick from it. But it's not. It's like really opened my eyes. And as I said, it is hard work, but you do get a lot from it.
Mm-hmm. And you get as much out of it as you put into it. So it's about seeking opportunities, and your mentor or the lead on the programme will support you and find you places like the RBI, like other services, if you identify that's, and she will facilitate that. So, you know, there's areas that you wouldn't have the opportunity to visit, but, you know, with the support of the lead, they will facilitate any identified areas, which again is just an absolute luxury to be able to access.
Can I just add to that everybody that I've came across in the cancer services as well, I don't know if it's the same for you, Alison, even though they're so busy, they're just so supportive, and they do seek out these opportunities for you, and they'll support you and like always chat to you and explain things they're doing as well.
Mm-hmm. And you know, and if there's something that they know is going to be interesting, they'll say, can you swap your day, because this, you know, or you might want to follow a patient through, so it's a negotiation, and it's very much a work in progress because the mentors are new to the programme as well. So hopefully from us, they've learned, like, you know, it's not just about sitting and watching and observing, it's about participating and, you know, doing assessments in clinics and things, and, you know, actually, because we are experienced nurses, so it's not, you know, it's not that we're students.
Yeah, you're not student nurses, you're nurses with a good level of experience.
Yeah, and, you know, they respect that as well, and which is lovely, because I know I'm not sure about, oh, well, I would do, you know, and you know, it is just a mutual respect. Mm-hmm.
It's a two-way learning, isn't it? Because with me and Alison being in the community, I think sometimes there's, through no fault of anybody, there's sometimes a bit of that divide between the acute and community, and we don't know what each other's doing. So, like, when one nurse is frustrated because they kind of get through to the district nurse and team to make a referral, you kind of can offer that kind of insight, well, we're really busy, and, like, why don't you try doing this? And, like, they'd like it if you handed over that information. So we're kind of like learning about each other's roles as well.
That brings us to the end of this episode. Thank you very much, Kelly, Alison and Michaela, for taking the time out of your day to talk with me today.
Thank you. Thank you.
Thanks for joining us for this episode of Our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.